SA Bone Marrow Registry has joined forces with Netcells. From this month, they will be making cord blood available to patients in need of a bone marrow transplant. Netcells is the largest and longest established private cord blood bank in Africa. But unlike other parts of the world, there's no public cord blood bank in South Africa, and the prohibitive cost of bringing in cord blood units from overseas simply isn't feasible for most patients. To tell us more about this, I'm joined now by Netcells Managing Director Shelley Breeden. Shelley, thank you so much for your time and good morning to you. Now, it is a concern when you look at the fact it seems access to bone marrow has been posing quite a challenge.
Absolutely.
Give us more details in terms of what attributes to this challenge, specifically in South Africa, Shelley.
So in South Africa, we actually only have around 76,000 bone marrow donors. Now, if you look at the access around the world, you're looking at about 36 million bone marrow donors. And in terms of our demographics in South Africa, we are exceptionally unique compared to the rest of the world. So a lot of our population is completely underrepresented on the bone marrow registries. And so for anyone to try and find a match, especially people of African descent, it is a really big challenge. You're looking at a chance of 1 in 100,000 of finding a match for someone in South Africa. And if you are of a mixed ethnic descent, the chances are much lower. So it really is a big challenge in South Africa.
Yeah, I understand that on that note, you are then partnering with the SABMR to improve donor matches. You, of course, being, the biggest cord blood bank that we're seeing right now. I mean, how exactly do you plan on improving these donor matches?
So what we've done is Netcells has been around for 16 years and we've been doing private stem cell banking. So what that has been is storing your cord blood for the use of your family and the child at birth. So we store those stem cells at birth. What we've done with the South African Bone Marrow Registry is we're trying to bridge the gap between a public and a private stem cell bank. So we have launched a community bank. What this is, we are subsidizing the rates of stem cell banking. So it's not as expensive as private stem cell banking, but the parents will still be paying for it. But that sample will be placed on the South African Bone Marrow Registry when the baby is born. So essentially, you are storing for your family, but you are also adding to the donor pool in South Africa. So that cord blood will be used, will be available for your family, but if someone in need needs it beforehand, that sample will be used by a patient in need in South Africa.
Right.
Which I think is fantastic.
That's extraordinary. And on that note, while on the topic, I mean, I understand that South Africa has quite an extensive, almost genetic diversity that we have here, which almost sort of like limits the donor pool. How do you aim to address these issues in terms of, donors, bone marrows, as well as, just the ethnicities and the different ethnic groups that we have in the country?
So what we want to do is we're just trying to make this available to as many people as possible, which is why we have reduced the price. And just to create awareness about cord blood, about the fact that the donor registries are so small in South Africa, and to just explain to people, the need that we have in order to be able to grow this donor pool. So, yeah, it's for us. It's mostly about creating awareness, and then also improving accessibility to cord blood banking.
All right, then we'll leave it there. But Shelley Breeden, thank you so much for your time. That's, of course, Shelley Breeden joining us there as the Managing Director from Netcells. All right, we'll leave it there.